Hello, everyone. I'm Chris Bratton, founder of Bratton Law Group here in Southern New Jersey. Welcome to our podcast, where we provide you with information in the areas of legal, financial, and healthcare advocacy. I'm extremely excited to speak with my guest today. Dr. Daniel Pizzi began his practice, A Reason to Smile Dentistry, based in East Windsor, New Jersey, in May of 2001. Dr. Pizzi is a graduate of Rutgers College and New Jersey Dental School. He graduated in 1998 and is a member of the Prosthodontic Honor Society. Dr. Pizzi also served a one-year general practice residency at Jersey Shore Medical Center. Welcome, doctor. How are you?
I'm doing great. Thank you for having me.
Absolutely. Doctor, certainly the public has general knowledge about Alzheimer's disease and its effects, but from a scientific research and practice standpoint, as a whole, we've been able to reduce certain deaths in U.S. occurring as a result of certain health problems like heart disease, cancer, diabetes, but deaths attributed to Alzheimer's has actually increased. Things such as diet, brain health, activity certainly play a part in that, but I think to a lesser known extent, oral health has shown to play a part in Alzheimer's disease. So I wanted to speak to you today about that. So first, if we can, let's start with a basic premise. How is Alzheimer's disease linked to infections?
So Alzheimer's disease is a multifactorial disease. So there's a great book called The End of Alzheimer's. It's written by Dale Bredesen. And he's a physician out in California who does a lot of research with Alzheimer's. And he used the analogy of 36 holes in a roof. There's 36 known factors to Alzheimer's disease. And you want to try, in the treatment of Alzheimer's, you want to try to plug as many of those holes to stop the rain from coming in. And so one of those holes is infection and inflammation. And that's right in the wheelhouse of dentistry. And so more than 80% of the population has some form of gum disease, whether it be gingivitis or periodontitis. Gingivitis being the more, the less severe, and periodontitis being when we escalate into bone loss. 50% of the population has periodontitis. So 80% of our general population just walking around has some form of gum disease and inflammation. And getting control of that inflammation, that's where we are. And odontogenic infections as well. There's another book called Beat the Heart Attack Gene, which is by Dr. Bradley Beal and Amy Deneen. And in that book, they cite articles in which 50% of heart attacks and strokes are started with an oral bug, an oral bacteria. And so when you're talking about trying to control inflammation, you're talking about trying to control multiple disease processes. You're talking about this cancer, you're talking about heart disease, you're talking about diabetes, you're talking about Alzheimer's disease. All of those disease processes are so impacted by inflammation. And the one inflammation that you can really deal with in your body aggressively is oral inflammation. That's something that people can control on a daily basis. That's something that they can get help with a dental professional. Those are things that you can actually control. And that's exciting because you can actually steer the car away from disease. And when you can steer the car away from disease and you know these things are coming, you can actually impact your health and the health of people around you. Because when you become an advocate for yourself, you become an advocate for others. And then you can actually impact people's behavior and their future health.
Yeah, I think people focus on their heart and diet to an extent and exercise, but I just think they don't have enough information to know about what's going on with dental care and how that ultimately affects everything that's going on. But as Alzheimer's progresses, why is proper oral care important?
So as Alzheimer's progresses, you lose cognition, you lose the ability to do certain things and the ability to remember to do certain things. And so you're going to see actually, when you're trying to care for yourself, you're actually going to see your inflammation going up because you're not doing what you used to do. You're not doing what you're supposed to be doing. And so how do you impact that? How do you make, you have to make caregivers very aware of, gee, we have to make sure that we were able to do oral care today for this patient, not just once a day, because it's twice a day. Like, dental hygiene can become very you need good dexterity, and you lose dexterity as Alzheimer's progresses. And so we need to come up with ways, and we have come up with ways in which dexterity, you don't need such great dexterity and still have great oral care. And so those are the kinds of strategies that are become so important, like making it so that we can kill the bacteria without having to being able to manipulate as we have to manipulate. Because yes, we have brushing. Brushing is great, and you can change the brush to become an electric brush, to have more action on it. There's water picking, but I'm going to be really honest. When you're in a long-term care facility, you're not going to get a water pick going every day. It's very messy, and it's not going to happen. It's not going to be something that happens on a regular basis. And those are the kinds of things that would really help. Flossing. Long-term care patients aren't going to get flossed every day. They're just not. It's not going to happen, and that's not going to be a reality unless their care person has been trained that way and will be very diligent that way. And if you look at studies in general population for people who aren't in long-term care facilities to get them to floss, I mean, that's slim. So we've come up with strategies to help people to not have to be so dexterous that way.
What can you touch on some cognitive limitations and maybe some workarounds for that that people can utilize if they do have cognitive impairment?
Sure. So the whole idea is the true enemy for us in inflammation is bacteria, and plaque, dental plaque, is where it's at, because plaque is the combination of both bacteria and food which is sticking to the tooth, which is being stuck there by biofilm. And so breaking down biofilm is where it's at for us. So we use a product in my office called PerioProtect, and PerioProtect are customized trays. They're rubbery. They grip your teeth and gums. They're very simple to make. We send them out to a lab, and they're customized to each individual. And then you put a gel inside that tray, and that gel is a hydrogen peroxide based gel. And it's at 1.7%. And what that does, you let that sit there for 15 minutes. It breaks down the biofilm. It kills all the bugs. And that is pretty simple. I mean, that's a very simple thing to do. It's comfortable. Not too many people object to it. And it is probably the most innovative advancement that I have seen in years, from coming from a gingival health standpoint. It will eliminate inflammation. It will eliminate bleeding. Now, it also has to be coupled with usually scaling, root planing, and regular dental visits. It doesn't eliminate the need for a dentist. It doesn't eliminate those things. It is an adjunct therapy to be done to eliminate bleeding, to eliminate bacteria. That's the goal. Getting the bugs off, getting the plaque off. That is key, and that helps to do so. That is probably the most innovative advancement that isn't in general knowledge, general public, which should be. Knowing that can be an advancement, because within the plaque, other bugs can live. Because when you culture that, if you're in long-term care, especially if you're in a long-term care facility, if you were to culture plaque, you will definitely find, there have been studies that have shown that influenza is being carried in dental plaque. And that's scary, because we just had COVID. We just had outbreaks in long-term care facilities. Was COVID able to live in dental plaque? There has not been a study that has shown that. But if influenza can, I mean, why wouldn't coronavirus? So you're looking at a situation where that would be something that you'd want to do to eliminate dental plaque in people's mouths and kill the bugs. So if you were to do that twice per day for anyone, you are making them less prone to disease. You're making them less prone to having advancement of Alzheimer's. You're looking for them to be less prone to have advancement of diseases which are influenced by inflammation.
And talking about the trays, how often do they have to do it? Do they only get it through the dentist? Can they get it over the counter? Do they have to go to a dentist that specializes in this type of oral care health?
So PeriProtect can be done by any dentist who's been trained in doing it, and but it's not over the counter. They are customized. You have to take impressions, whether the impressions can be digital or they can be by conventional. It's an alginate impression. It's very simple. It has to be sent out to a lab, and then you acquire the gel, and then you're off and running. So you do need this. This should be in conjunction with a dentist who's monitoring your situation, because periodontal disease is something that can be measured. It's something that you can actually take a little device, and we can actually measure the top of the gum to about where the bone is, and it's something that we can measure, and we can actually see with our eyes bleeding points. Because if you have bleeding, a very common description of periodontal disease in the general public, if you see pink in the sink, if you spit and rinse and there's blood in that sink, you have a problem, whether it be gingivitis or periodontitis, and you need to get to your dentist and hygienist, and we need to figure out what's going on. Bleeding is not normal. Bleeding is never normal. If you have bleeding in your mouth, it is not normal. It's a sign of inflammation. You have a bug problem, a bacteria problem, and that needs to be treated aggressively. There have been studies that when you have blood work done by physicians who are very proactive about prevention, there is an inflammatory marker that when they basically eliminated everything. What is that inflammatory marker coming from? It's coming from the fact that they have gingivitis or periodontitis in their mouth and they are not being properly treated. And that amount of inflammation it doesn't have to be like a full mouth full of infection. It could be in one quadrant. It could be one tooth where you're having severe inflammation, and that is setting off that marker throughout your body, which is why this is so critical. But why bleeding has become something that in dentistry, totally and completely unacceptable. Because I'll tell you that in years past, when I was a younger dentist, like if you had somebody who had some pocketing in their molars and they would have bleeding, it's okay, we'll let that pass. We'll keep an eye on that, Mrs. Jones. That is no longer the case. That is unacceptable. It's not something that can be accepted because we're seeing these studies come out. Particularly the study in Circulation where it linked heart attack and stroke to 50% of them being set off by an oral bug. That makes like an explosion in your brain saying, oh my goodness, we have to be super aggressive because we are impacting people's health. We are impacting people's lives. And these things are influencing Alzheimer's. It's influencing heart attack and stroke. This is right where we live, and we have to be able to be more aggressive this way. When you have people who for years have neglected their oral care, and that sets off a chain of events, that is exactly what we need to do. The earlier we can get to these people and eliminate the inflammation, we are taking one of those boxes, one of those 36 factors which influence Alzheimer's. We're taking that off the table. When you take something off the table, you are steering the car in the correct direction. And if you're willing to do, and I'm going to tell you that from experience, if you're willing to go to the levels that you need to go to from an oral care perspective to take that off the table, you're willing to go the other steps too. You will make those changes in diet. You will make those changes in exercise. You will do those things that are necessary, because I have personally steered friends who we watched their dad just deteriorate from Alzheimer's disease. It was early onset. He was in his late 50s. It was hard to watch. It was hard on the family. It was, it's heart-wrenching. And I will tell you that that is one of my motivating factors to be so aggressive this way, because I personally went on a journey to make sure that this wasn't going to happen. Obviously, this is in the DNA of my friend. I mean, obviously, this is on his path, and he has a family. I don't want to see his kids have to take care of him like we were basically thrown into that world of taking care of his dad, because that is something that you don't want to ever see, especially about people that you care about. You don't want anyone to have to suffer that way. So when I saw that, I said, how do we change this? How do we impact this? And that's really what truly led me on this path to eliminate inflammation orally. Like, and you would think like, well, you're a dentist. How are you going to impact this? I mean, how are you going to, I mean, you're not an Alzheimer's physician. You're not a cardiologist. You don't do these things. But what I do deal with impacts these things so greatly. And when I realized that, and when I realized, hey, I could help put this person on a path to health, and connecting him to a physician who practiced preventive medicine, connecting him to a physician who knew about the advances in Alzheimer's therapy, who knew about the end of Alzheimer's with Dale Bredesen, and the fact that there are actually like signs of hope with things like Recode, which are mentioned in that book, to bring people back from the brink of Alzheimer's who are on that path. And there's a pathway to health. That's what truly motivated me to make sure that there's a way to prevent this. And that is amazing to me. When you have seen the other side, when you've seen the pain, when you've seen loved ones just going down from this, and knowing that, hey, you know what, we can make this not happen again. And that's what charges me every day.
Yeah, a large part of my practice is helping individuals with Alzheimer's from a legal, financial, and healthcare perspective. And this is not an area that I was even aware of. One more question. From a treatment standpoint, is there anything else that you would recommend? Do they need to come in to the dentist more often than twice a year, or do you put them on a specific protocol if they have a diagnosis of Alzheimer's?
Yes, absolutely. So when they are it's not so much specific to a diagnosis of Alzheimer's as it is relating to their periodontal care. So usually when you are in gingivitis, when you've been diagnosed with gingivitis, when you've been diagnosed with periodontitis, the regimen is not twice a year. It should be 4 times a year at minimum. Sometimes that's coupled with other adjunct therapies such as scaling and root planing, which is a deep cleaning. Sometimes it's coupled with, in my office, it would be laser therapy. Sometimes we have to incorporate the help of a periodontist who is a specialist in periodontal disease, in which case surgery may be necessary, in which case removal of certain teeth, which are not savable, may be necessary. Those things are on the table. Like when we are dealing with a situation, it all starts with diagnosis. It all starts with where are we beginning? And when we get a good diagnosis and we can lay the roadmap out for proper care. And that proper care does involve coming in more frequently. That proper care will definitely involve perioprotect if you're in that world. That proper care will likely be asked, hey, you know what, we need to get some sonic brushes in there, some electric brushes, like for Philips Sonicare or Oral-B. Those are 2 companies that make a very solid electric toothbrush. And if you're going to talk about which is better, when you're removing plaque, anything that's moving in your mouth is going to be better than a manual brush. Every study shows that. So, but those are 2 of the better brushes on the market where you're not going to have to change it out every year. So that's those are, if you can get a water pick, and have that on board, great. But again, when you're talking about advanced Alzheimer's and you're talking about people being asked for caregivers to use it, I don't think it's not a usual thing. You have a very special caregiver if they're using a water pick on somebody every day, and that's something that is rare, as I'm sure you've encountered as well. So yes, more frequent care is exactly what we're looking for.
Yeah, so for anyone listening, whether there's been a diagnosis or not, again, like you said, if you can plug any of those holes, whether it's oral care, diet, brain health, exercise, being able to reduce that overall inflammation, is something that everyone needs to consider and work on. Doctor, I know you're busy, so I want to thank you for joining me today. This is an important area of concern that I really don't think many people know about or have taken the time to even consider, but I want to thank you for discussing this today. But before we go, can you please let everyone know how they can get in touch with your practice if they have any questions or concerns?
Of course. My office is located in East Windsor, New Jersey. Our phone number is 609-426-4500. Our website is reasontosmiledentistry.com. You can reach out to us at any time, and we will definitely get back to you. This is exactly where we live, in inflammation land. This is where we help people, and this is our motivating factor to give you a path to health. And if you allow us to be a part of your journey, we take that as a high compliment. And that's what we do every day. We want to bring people health and bring them a pathway to healthier lives.
We appreciate it. I appreciate your time. And of course, if anyone needs to get in touch with us, you can find us at brattonlawgroup.com or by calling our office at 856-857-6007. Once again, thank you, Doctor. I appreciate your time.
Oh, thank you so much.